Hey, Justin.
Oh, hey, Megan. Hey, listen, can you help me with my new admission? I'm going to place some standing delegation orders for abdominal pain for patient Gonzalez in B4. And while I'm doing that, would you mind getting an IV for me and some labs?
Yeah, I'll do it right now.
Thanks.
Good morning, Mr. Gonzalez. My name is Megan. I need to put an IV in you and do some blood. Is that okay?
Sí.
It's okay. Hey, Justin. I got your blood.
You got the IV in the blood?
Yeah.
Perfect. Thank you so much, Megan. Why don't you just hand it to me because I have to go into the room and I need to label her urine specimen for her pregnancy test.
Wait, you're going to do a pregnancy test on Mr. Gonzalez?
No, I'm going to do a pregnancy test on Mrs. Gonzalez. Megan, can you help me with this outside real quick? Un momento, por favor.
Using two patient identifiers is vitally important to the safety of our patients and the success of the care that we provide here at Parkland. What happened to Megan, and more importantly to Mr. Gonzalez, could have all been avoided if Megan had just used two patient identifiers. Megan had several opportunities to catch her mistake before providing care to the wrong individual if only she had followed Parkland policy and the best practice of using two patient identifiers before performing any care on her patient. Let's review how many different places the previous scenario went wrong. First, when Megan was asked to place an IV and draw labs by Justin, she did not obtain specimen labels or lab requisitions containing the patient's full name, MRN, and date of birth to verify correct patient identity. Second, Megan entered the room and observed Mr. Gonzalez sitting on the bed. She led the patient by asking him if he were Mr. Gonzalez instead of asking him the question, "For your safety, tell me your name and date of birth." Unfortunately, Megan also never assessed a possible language barrier despite the fact that Mr. Gonzalez's responses to her questions were in Spanish. In addition to these errors, Megan failed to check for an armband on the patient to verify correct patient identity. Lastly, Megan made another error in policy and procedure by walking out of the room with unlabeled specimens with the intention to label them at the nurse's station. All of these failures led to Megan providing care to the wrong person. And while thankfully Mr. Gonzalez will not likely suffer any long-term harm from this mistake, Mr. Gonzalez and his wife no longer have the same confidence in their care team. Now let's take a look at the scenario again where Megan effectively uses two patient identifiers to avoid a mistake like we just saw in the previous scenario.
Hey, Justin.
Hey, Megan. Listen, would you mind helping me with my new admission? I'm going to place some standing delegation orders in Epic for patient Gonzalez in B4. And while I'm doing that, would you mind starting an IV and getting some labs for me?
Yeah, I can do it right now. Do you have some demographic labels I can take with me?
I certainly do. Here you go.
Thank you. Good morning, Mr. Gonzalez. My name is Megan. I need to put an IV in you and do some blood. Is that okay?
It's okay.
Okay, for your safety, I need you to tell me your name and your date of birth. And I need to take a look at your armband. Where is your armband? Oh, Senora Gonzalez. ¿Hablas inglés?
Very little.
¿Es su esposa aquí?
Sí, está en el baño.
Oh, su esposa tiene dolor en el estómago.
Sí, sí.
Oh, okay, gracias. Regreso en 2 minutos, okay?
Okay, gracias.
Okay.
By using two patient identifiers, Megan was able to verify that Mr. Gonzalez was not the correct patient, even though upon first glance with him sitting on the ED stretcher, it appeared he might have been. By asking Mr. Gonzalez, "For your safety, tell me your name and date of birth," and attempting to verify the information against the patient's armband, Megan was able to avoid the mistake that we saw her make earlier in this video. Remember, before any procedure, lab draw, medication administration, or intervention of any kind, always ask your patient, "For your safety, tell me your name and date of birth." Please remember, two patient identifiers, every patient, every time.